Hello, hi everyone. Good evening from Chicago. Thank you for joining. My name is Ryan Flores. I am here with Michael Walls, who is the president of the AMSA chapter, and we are very excited to be here today. We're here to talk about U.S. clinical experiences, and I know Michael is here to talk about AMSA's role, our partnership, AMO's partnership with AMSA, and just some more information that will be helpful for you all. I want to thank you again for joining. We will also send a recording of this webinar at the end for those of you who are in attendance, and then those of you, of course, who are not. But before we kind of begin, just a quick outline. We'll kind of start with Michael introducing himself. Throughout the next 30 minutes or 45 minutes, Dr. Raquel should also be joining. When she does join, we'll give her some time to speak about her practice, about family medicine here in the US, answer any questions that the audience has, and then we'll jump into a little formal AMO presentation and then some questions and answers at the end. So with that being said, Michael, I'll just pass it over to you if you want to go ahead, introduce yourself and a little bit why you're here.
Awesome. Thanks so much, Ryan. It's good to meet everyone on the call. So my name is Michael Walls. I am the president of AMSA, as Ryan said. I'm originally from San Jose, California, and graduated from medical school at Touro University, also in California. AMSA is I'm taking this full year to do just AMSA, which is pretty great. And I'm applying emergency medicine in like a day and a half. So I can hopefully answer any questions for those of you interested in emergency medicine. But really, I wanted to talk to everyone about AMSA, who we've been partnered with AMO for a while now. So AMSA is the American Medical Student Association. We have members, both pre-med, domestic medical students, and international medical students. So for all of you international students, we do also have a way for you all to get involved. AMSA was originally founded as the student section of the AMA, which can be confusing, but we broke off during the civil rights movement and have been completely student run ever since, and even a little bit before that. But so with AMSA to me is really important because, the message that really brought me in was creating physician leaders, which I think is the epitome of what AMSA does and really is intended to do. Because we understand that, being a good physician is not just being good in the clinic and being able to do all of the medicine. All of that can come with time. But what is oftentimes missing from medical education is some of the other aspects that have become more and more prevalent in US clinical care in the past 20 or so years. So things about thinking about how socioeconomic status can impact your patient and ways to approach patients that, can't afford their medication or who have, quite often been discriminated against. Abortion access is a really big thing that impacts patient care, impacts physician wellness. And so AMSA has really been working for a long time in that space to create physician leaders, physician advocates, people who are going to go beyond just treating their patients clinically, but also working to improve their lives outside of the hospital, outside of the clinic. On top of that, as being an AMSA member, you get awesome discounts. Like you get a little step in with AMO. We have discounts on everything from wellness programs, discounts on Office Depot, all of that. So there's also the financial benefit of joining AMSA on top of all the educational and really networking. So also coming to our AMSA convention, presenting a poster at our poster session, which is always super fun. But yeah, so I think that's it for AMSA. I did want to highlight a couple medical education things that we're working on that I think we're really excited about. The biggest one being our medical education scorecard. So we're starting domestic, and we're hoping eventually we can expand international to grade medical schools on issues that medical students find important. So things like diversity, equity, inclusion, anti-racism, student wellness, whether or not you're getting career advancement opportunities, things like that. And so we're hoping that we can get that out in the next year or so. It's a fairly intensive research project, but we're really looking forward to it. And I will certainly let Ryan and everyone else know when that goes public, but that's our biggest project for improving medical education.
Thank you so much, Michael. And I think just what's so important for everyone here is just realizing the resources that we are for everyone. And, we want to provide the opportunity, want to give back, we want to be a resource. I love the partnership that we've developed, again, sharing resources, sharing networks, and just making sure that international students, US students have the resources that they need to succeed, and how we can factor in the medical journey and really help one succeed. I think it probably plays well to both of our missions. So thank you so much, Michael.